It's important to learn how to safely restrain a horse for both the horse and your safety, to give medications or for training purposes, and just really from overall safety. It's important to learn how to safely restrain a horse. The escalation of restraint with a horse is really different for each horse. I have found that over the years, horses like anything from blowing in the nose to tapping on the frontal sinus on the forehead, to shoulder twitch, to even using a lead shank over the nose or in the mouth, 99% of the horses respond quite well to one of those methods. The first level of restraint is obviously using a halter and a lead rope that has good secure snaps and that is in good condition from a safety standpoint. And then if they need further restraint from there, you can move into the shoulder twitch, or either blowing in the nostril or knocking on the forehead as my first line of restraint for these guys. To administer the appropriate shoulder twitch, I think it's important to understand that not all horses like that. And so if they do like that, a shoulder twitch is properly applied by taking your right hand, grabbing some of the skin on the shoulder or neck area and rolling it in towards the horse as you hold the lead rope with your left hand. This is used to distract them while you need to do any sort of procedure or administer any medication. A nose twitch is where we gently grab the nose to release pheromones in the horse, and this calms them down while we need to do any procedure. First, make sure the horse is amenable to it. Gently grab the nose, providing a gentle squeeze to see if the horse likes the nose twitch. If they are, the application of the twitch goes on the nose and then is tightened down, twisting that twitch to keep it on nice and secure. So the nose blow works quite well, and it involves blowing air in the nose to distract them from whatever procedure they're about to have. I find that the nose blow works well in those horses that don't like to be touched too much, and so it's a way of distracting them by just putting some of your air into their nostril. You do have to be careful in how close you get to these horses and how long you blow in the nose, because you definitely don't want to compromise yourself in the process. Rubbing of the upper gums, I think, is a nice technique to use to soothe the horse, and it's one of the common techniques that I use in the wintertime, as the inside of the horse's mouth is a whole lot warmer than the outside of the horse's mouth. First, open the commissure of the mouth, and then take your fingers just gently over the upper teeth and see how the horse likes the technique, and then basically just run your hand back and forth and just relax the horse as they are going through the procedure. This technique is really nice for young horses who just really enjoy that sort of sensitivity. A halter and a shank across the nose is used for those horses that are being a bit more difficult than the first line of defense. This technique is used to grab their attention across the nose and hopefully put them in a great mindset for your procedure. So for this method, you would need to use a nylon halter with nice square rings. The lead rope is detached and the chain is run through the left side of the halter, over the nose, through the right side of the halter, and then connected at the top ring of the halter for proper restraint. This technique should really not be used with a horse that is fearful or scared of you. These are only used for horses that are maybe not being super nice, but if you have a horse that's being fearful or scared, this can only make things worse and can create a really bad situation for yourself. The use of a halter with a chain over the top gums is really my last method of restraint. It's a bit more aggressive method of restraint, and I only use this for horses that are really aggressive or could be dangerous to myself or the horse owner. The application of the halter with a chain across the gums is a bit different than just putting it over the nose. So this takes patience and takes time. To apply, we bring it down the bridge of the nose and put it inside the upper gums, and then use that as a method of restraint. A horse owner should not use the chain across the gums as a method of restraint, as if they're not really comfortable doing the procedure. I also think that it's not terribly safe for horses that are really young and just naive. So I would think the owner needs to be quite comfortable with the application of it, and it needs to be the right horse's attitude. The applications for chemical restraint are anything from pulling mane to farrier appointments to doing bandage changes. Additionally, we can also use this medication prior to veterinary or farrier visits, and so the horse can, in essence, chill out before any of those procedures are done. The chemical that we are using most commonly is called dermosidan gel, and that is a prescription item that must be picked up from your veterinarian and then administered by yourself. This medication is an oral medication that is given under the tongue and is easily given, but it must be given 45 minutes prior to the event or the procedure. If you have any further questions on how to properly restrain your horse, please consult with your veterinarian before doing so.